All right. Good morning. My name is Raquel. I'm going to be your nurse today, and I'm here to do an assessment of your heart, lungs, and abdomen. Are you okay with that?
Yes.
All right. Can you verify your name for me, please?
Mildred.
All right. Can you? What about your date of birth?
January 1st, 1990.
Very good. Are you aware where you at this time?
Yes.
Okay. And are you aware of what day it is?
Yes.
All right. Can you give me the date?
Today is May. Today is June 1st.
Perfect. Perfect. All right. I'll give you some privacy. I'm gonna sanitize my hands, and I'm gonna start the assessment with your heart, okay, and your lungs. I'm gonna assess your anterior lungs and heart. And for the purpose of this video and the privacy of the patient, we will not be removing the clothes. We are aware that this kind of assessment has to be to direct skin, but because of the privacy to the student and the fact that we are filming, we will be keeping the clothes on. So first, I'm going to start assessing the lungs, and for that, I'm going to be using the stethoscope. Now I'm checking the heart going into the second vertebral space, and I'm checking the aortic, the pulmonic, the Erb's point, the tricuspid, and the mitral. I'm checking the lateral lungs in one side and the other side. And now at this time, I'm going to be moving towards the posterior portion, and I'm going to check her lungs. For the cardiac sounds, the S1 and S2 were heard. So I'm moving now towards the pulmonic area. As I touch your skin, I want you to take a deep breath in and out, okay? Every time I touch your skin. Good. The sounds of the lungs are clear in all loops. Now I'm going to have you lay down, and we are going to check the abdomen. Good. You can put your hands to the side, and once again, I make mention that the patient should have no clothes. Her abdomen area should be exposed. But for the purpose of this video, I'm giving privacy to the student here, and I'm going to just make mention that as I'm going to assess the abdomen, first I will be inspecting her abdomen for any lesions, any wounds, any masses. I'm looking for the color of her skin to be equal to her ethnicity, and the pulsation as well. I will begin the assessment auscultating her abdomen, and I will begin at her right lower quadrant. I ask the patient, are you having any problems with your bowel movements?
No.
When was the last time you had a bowel movement?
This morning.
Okay, and as a female, when was the last time you had a menstrual?
Last month.
Okay, very good. Now at this time, I am going to auscultate her vascular sounds, and I will begin with the aortic. And for that, I will be using the bell of the stethoscope. I will be listening as well to her renal sounds of the vascular renal, and then the iliac. I will not be listening to her femoral sounds because of privacy. So that portion I will leave that alone. Now, after I have auscultated her abdomen, I'm going to palpate, and I'm going to do a light palpation. Start again with her right lower quadrant, palpating gently. You let me know if you're having any pain as I touch your area. And I actually, as I'm palpating, I'm looking for any tenderness. Now, as I have done the light palpation, I'm going to do a deep palpation. And for that, I will be using both of my hands. Let me know. I'm looking also for any masses now, any rigidity, or any tenderness. Okay, I have concluded the assessment of the abdomen, the heart, and the lungs, and I appreciate you giving me the opportunity to do so. Thank you.
You're welcome. Very good.